So I think today at the launch we heard of the level, even out there in the post office, the person who was dealing with the person who wanted to cash their pension a few times. And doesn't it resonate with us in reality that people don't live their lives within a HSE or surrounded by the HSE? They live their lives in their own homes, in their own communities. And that is where we have to take the education out to and the awareness. Specifically from the HSE's perspective, we have a staff of almost 100,000 people. And while not everybody needs to have a training in dementia, I would suggest that everybody has to have some levels of awareness, and obviously there are a very significant and large number of people who need a high level of awareness of how to deal with people with dementia as they deliver their specific service. And I would also feel that we need to do that in a multidisciplinary way. Multidisciplinary within the HSE through our primary care teams and our specialist services, and also in the broader community with the other providers such as Gardaí, general people working in the services, etc. I think one of the key pieces around education is awareness, and for the likes of myself, as I meet somebody who has a dementia, and if I have some background knowledge of even the way I might approach the communication, as the way that I actually phrase my questions, or whatever might be the case, I can gain from that interaction hugely and be able to help that person and assist them. So whether if I was a GP and I needed to actually gain information so that I could make an accurate diagnosis, it's hugely important that I would have a level of awareness as to how to do that. So I think that have a direct effect on people's lives, and also the things that we probably take for granted, which might be a huge issue for people who have a dementia. We just need to be aware that taking those things for granted are just sometimes inappropriate, or more times is a blockage to what we are trying to do. So you could go with all the best will in the world of providing a service or trying to support somebody in whatever way, and in actual fact it might be quite counterproductive if you haven't some awareness and education. I think unfortunately we have huge gaps in dementia education, to be truthful about it. And when I take it just from the HSE perspective and thinking in terms of, at the moment we are developing still our multidisciplinary approach to how we provide services in the community through primary care services. The levels of gap that we have in terms of specialism around geriatric services, etc., we have very significant gaps to meet. So there is a piece around the diagnosis, there is a piece around general awareness. We also have, I suppose, significant numbers of people who are in residential care, both in terms of public, private and voluntary providers of that type of service. And that is a huge category of people who are dealing with high percentage of people who have maybe quite an advanced dementia and with low levels of training in many instances. So I would feel that they would be the key areas that we'd have to concentrate on as we move forward into the future.